Hi, I'm Courtney Channels. I'm a nurse practitioner and the lead coordinator for the Inova Atrial Fibrillation Center. I'm going to spend a few minutes discussing how AFib is identified and diagnosed. AFib frequently starts and stops on its own. Sometimes episodes can be just a few seconds long. This can make the initial diagnosis tricky. You could be in atrial fibrillation at home, and by the time you arrive to the office for an EKG, you may be back in normal rhythm. Because atrial fibrillation can come and go, extended monitoring is often needed to help diagnose, quantify, and classify your atrial fibrillation. In addition, while some patients are symptomatic from atrial fibrillation, others have silent atrial fibrillation, which means they are unaware when they are out of rhythm. Extended monitoring can assess for arrhythmias and see how well your heart rate is controlled. Monitoring this data can help us decide which treatment option is best for you. In addition, extended monitoring may be useful to further assess response to treatment. There are several different types of ways that we can monitor your heart rate and rhythm over time. One option is a short-term, continuous ambulatory cardiac monitor. While a standard EKG monitors heart signals for several seconds, an extended monitor allows us to continuously monitor your heart rhythm while you conduct your normal activities. These monitors are attached to your chest, either using small electrodes or through a patch which holds a sensor. Monitors may be worn for a period as short as 24 hours or up to 30 days, and duration will depend on the recommendation of your medical provider. Data from the monitor will be reviewed by your care provider after you have completed the designated monitoring period. Some monitors have the capability to transmit data real-time to your physician's office. An extended monitor is ordered by your provider, and most insurance companies cover the majority of the cost. Another option for monitoring your rhythm is utilization of a wearable device you may already own, such as an Apple Watch, Garmin, or a Fitbit. These newer devices have sensors that can use pulse wave technology to identify an irregular heart rhythm, like atrial fibrillation. With these devices, you can easily upload the irregular rhythm strip to the Inova Epic electronic medical record through your MyChart account. Your provider then reviews it, or you can bring those recordings to your next office visit. An alternative home monitoring option is the Cardia device, which is a portable EKG monitor. This is something you would purchase on your own and is not covered by insurance. The cost is roughly $80 to $100. This is a small device which pairs via Bluetooth to your smartphone. It has two small electrodes, and you place your fingers over these two electrodes to obtain a single lead EKG. Patients often use this device if they are at home and feel symptoms to confirm whether they are in atrial fibrillation. Similar to other wearable devices, Cardia provides the capability to upload that rhythm strip to Epic MyChart for review by your provider. Finally, some patients may benefit from implantation of a small, long-term cardiac monitor, which is done as an outpatient procedure. These devices provide continuous EKG monitoring and last up to 5 years. They are capable of transmitting signals from home. They have been particularly effective for identification of AFib in patients with a prior unexplained stroke. In conclusion, new monitoring technologies have made it easier to diagnose and classify atrial fibrillation. Many options allow the patient to transmit their rhythm information to our clinic seamlessly.